FRêMITO, o podcast vascular do perfil O Fogart da Madrugada.
Esse é o FRêMITO Podcast Vascular, direto do Congresso Brasileiro de Angiologia e Cirurgia Vascular. Nós estamos recebendo o Dr. Sérgio Gianesini, que é professor na Universidade de Ferrara e o atual presidente da UIP. Dr. Sérgio, it's a very pleasure to have you here in FRêMITO Podcast Vascular.
Thank you so much, guys, colleagues and friends from all around the world, because of course this will be a global event.
So before you are discussing and talking about a new registry for venous disease that you have been applying in Italy.
Yeah, I think it's groundbreaking, literally more than brand new, meaning that the authorities are requesting us, since actually 2018, to combine clinical trials with also real-world evidence. What do I mean by this? Would you use a parachute if you are like jumping out of a plane? Would you guys?
Of course.
Think it could be used? Would you have a recommendation 1A of using it? Is there a randomized comparative trial that combined one group with and one group without parachute to prevent death from jumping out of a plane? This is a real publication. This is a real publication in PubMed that is using this metaphor of the parachute to demonstrate that, particularly in the difficult field of veins and lymphatic care, we have so many confounding factors. Take, for example, the pool, like this wonderful place where we are in Iguazu. Say that somebody is going into the water, right? Like every single centimeter of water will be 0.7 millimeter mercury, which means that if I'm standing up into the pool, I'm having 80 millimeter mercury acting on my leg. Now take a device and look if it is working. And then maybe you use that device, the other colleague does not use the device. And one is going to the pool, the other is not going to the pool after using the device.
So SVS in US has something similar. What is the name of the registry in SVS?
That's totally different. That's totally different because that registry is a traditional registry that is looking at collecting data from case report forms. Here we are talking about maximizing the data you're getting in contact with the patient through a dedicated software before the patient comes to you. Think about how much time you have for a visit. In 30 minutes, you cannot fill in the registry and all the information you want to know. Is he going to the pool or lifestyle and so on? But if I send to my patient legally certified invitation to fill in all the data before the patient comes to me, I already started the visit before and I have a lot of data. Then when it comes to me, I validate the data very quickly and I just include my part. So you optimize the data collection and you save time.
And you have an app to do that?
There is a software that is dedicated, V-Regestry.com. It took us like years of work.
For now, the patients are all from Italy or Europe?
This is absolutely global. Our organization, Venous Lymphatic Ward International Network Foundation, is 43,000 colleagues around the world. It's already also in Portuguese, so I invite you to have a look at that. And it's facilitating also the management itself for your office because, again, you save time having already collected a lot of data before. As always, also in medicine, when you say safety first, we live in a digital world. So also digital health safety first. What I mean by that is that we are unaware of the risk of health data breach. So, for example, even if we send a mail nowadays to our patient with personal information and then our mailbox has been hacked, we are legally responsible. But we don't consider this. So it's very important, all the privacy part behind that. And I tell you, like the biggest effort was put on the legal aspect of that because of the control of the health data that is changing in different countries. So that's, I think, the innovative part that is allowing us to be totally different with this project from what you have.
Nice. And after months, years collecting data, what to do with that?
Well, as I was saying exactly at the beginning, steering the clinical governance. Because if you look now, legally speaking, the recommendations we have, I mean, I represent the UAP, the World Society of Phlebology and Lymphology, but even if we put guidelines out there, they are not going to be legally binding for you. So we have to advocate for patients, but also for our colleagues to offer tools that determine clinical governance, which means appropriateness.
Perfect.
So those data are leading to clinical governance.
So
essentially, we're being pushed to do this, to have data.
We are absolutely already in delay, because if you look at the legal liability of that, if you have experiences in trials, you will see that many times you don't have strong papers that you can quote in front of the authorities around the world for this. That's why our organization, this huge organization of yours as
and
well.
it's working for all the venous and lymphatic disease.
Yeah, this is conceived for acute and chronic venous and lymphatic, but of course it can be reproduced in other conditions, and also you can branch out with the specific extra information you want to put in, because maybe you are doing a particular study.
And the pilot one is already working like this?
Yes, the pilot one is already working like that. There is a backbone of data specifically for veins and lymphatic patients, ready to add your part if you want. So that tomorrow you start investigating the impact of chronic venous disease in people who are standing up for more than 6 hours in a working place. Easy, you add your part, it will get validated, meaning that we have to be sure that it's ethically approved and so. But in this way, you have a tool also where you can fish the data of the other in a proper way, meaning that it's aggregated data. So you will never know, of course, who those data belong to. But it's a way also to look, like we are globalized also in terms of the disease, but in a sort of way, think about like the anticoagulants in the Asian people who are working differently compared to ours.
You can make a comparison, right?
Yeah, I mean, we definitely have to come out with a global vision, but at the same time, we have to nationalize the indication, I think.
Yeah, because let's say here in Brazil, we have a very big country, and we have different physicians doing different treatment. So how do you deal when we are speaking of worldwide registry?
This is so interesting because indeed you are a continent, and we have a specific pilot project for your region of Pantanal. Meaning that also you have the interesting part of not being able to even sign of the tribes and such. So in this way, actually, we bypassed this issue as well with the local doctors who are already reaching out to the population there. Like Dr. Peroni is working on this. So you will set an example of how this super interesting reality of yours can benefit from this kind of digital technology that can combine also paperwork in case you don't have digital access, but then you have the possibility of monitoring what is happening, for example, in these tribes, in these people living in rurality. It's interesting to me, 50% of the population is actually living in rurality, not in just in Brazil, but also in Italy. They live in the Apennines, they don't live in the cities. So digitalization also helps reaching out to people who are in permanent lockdown, like not in COVID, but we are in permanent lockdown with these people. They live far away from the healthcare centers.
So a huge problem here for us to collect data is to apply the questions and to keep the physician and the patient engaged on that. So obviously you have the same problem before, say, the experience in US, because they has so many benefits for the physician to keep introducing data on the bank. So how to keep physicians and patients engaged on that?
Well, patients appreciate, I tell you, in the first 6 months pilot time, the fact that you really customized around them your data collection, because they understand that if one day before going to the visit, they have already asked to have a detailed history taking, they perceive the care that you have about that. So that comes easy. I don't see a problem with the patient. Eventually, the problem could be patients in an older age. How do they manage the technology? But we are old enough, even if I hope we are not so old, to belong to a generation in which, for sure, at least the son of the old ones is able to manage the digitalization. In terms of the colleagues, the benefits that they are having is all the events of BWIN around the world. Every week, basically, we have events are for free for them to come and present their data. So it's a sort of engagement. But also you have doctors who don't care about this. This will facilitate, though, their workflow in the everyday management, because, again, it will shorten up their visit. And, of course, in this way, you collaborate also with the clinics who are understanding that they have a treasure of digital data that they are not using. Because bear in mind, we are multi-specialists. Because when you're talking about varicose veins, you're talking about 50% of the population. So even if you're a rheumatologist, you have 1 chance out of 2 of having in front of you somebody who has a thrombotic risk. So this is helping you managing at best the patient as well. Of course, there will be a natural dropout. But if you look at the numbers globally, even if you have 20-30% of dropout, you still are talking about huge number. Only you guys from this amazing country of yours that we love so much, I mean, you can produce data for all the world from here with very different realities and regions. And so I really hope Brazil, that's why we chose as languages to start Italian, because I'm biased as I'm Italian, but of course English, but of course Spanish, Portuguese, Russian, and French, because another part is Africa that is French speaking in many countries. So.
If you could like finish with a take-home message for us, for the people that couldn't make to the conference, what would you tell them
Come
about
next
it?
year, because it's an amazing congress. Don't miss it.
It's true.
We had truly nice colleagues with a true level of science, with also an international gathering that is really making this a global event, for which I really congratulate all of you, and I really thank you for having me here.
Thank you very much, Dr. Sérgio, to have us here.
Thank you. Ciao. Obrigado.
Não deixe de continuar acompanhando os episódios do FRêMITO Podcast, direto do Congresso Brasileiro.
FRêMITO, o podcast vascular do perfil O Fogart da Madrugada.